Hey, welcome back to the second of the two-part video lecture series on sheep feeding. Let's finish our discussion with regard to how to feed out those lambs and be profitable. So, as we get to the part about feeding lambs and how we take care of those babies in particular, hopefully they're nursing within the first hour. We want to have some management interventions ready in place in case they don't. But they should be up and nursing within 30 minutes, and that's very, very critical for antibody transfer and getting those young lambs off on a great start so they've got some nutrition in their belly. We hope that they're consuming about 6 to 8 ounces of colostrum. And I say bottle feed if necessary. It's a great idea to have some colostrum replacer on hand. Should you have a ewe that has a problem, you are prepared to take that on. If you wait to identify that you have a problem and don't have anything on hand, then by the time it takes you to run to town, grab something, get home, mix it up, and present it, you're way, way behind the 8 ball. So always be at lambing time, monitoring and making sure those ewes are up and going and those lambs are getting ready to nurse. So then it kind of stands to reason as we follow with milk replacer usage. If you need to go to utilizing milk replacer, they need about half to a pound per head per day, split in 2 feedings. And then, if you're going hand feeding like that, you'll want to plan to wean by about 3 weeks of age in order to reduce cost. It just gets too expensive to do it much longer than that, and average daily gains will go up the sooner you can get them on dry feed. So if you're going to do that, if you're going to go to milk replacer, switch them early. Don't allow them to nurse for, let's say, 3 to 5 days or a week, and then switch them to milk replacer. If you're going to go milk replacer, do it right away. And a couple of key things here is, of course, starvation risk is huge. It's the largest cause of death early in lambs, so you really want to be ready, identifying those orphaned lambs, the ewes that are milking at lower rates, the ones that have triplets, or those weak lambs. That's going to increase your mortality and morbidity rates for lambs, so you want to make sure that you're taking care of those babies, carefully monitoring them right up front. And then always have access to dry feed and water. Those lambs will start nibbling on some grain, probably at that week of age or so. And again, the sooner that you can get them on your grain ration, that's going to improve feed efficiency, average daily gain, and therefore profitability. Okay, a little bit more on feeding lambs. Once we get the weaning time, which should be about 25 pounds of body weight if we're using milk replacer, and that ration should be about 18 to 19% crude protein. If they are nursing on Mama Ewe, she's going to naturally wean them at about 40 pounds of body weight. So they'll go a little bit higher in terms of weight gain. After that, once we hit that weaned diet, we can go 14 to 16% crude protein diet, get rapid efficient gain on them up to 75 to 100 pounds. Always got to keep that stress down in order to keep these lambs eating well and gaining efficiently. And once you get past 100 pounds body weight, then we can drop it down if you want to do a phased feeding type approach, but many will just use the same ration all the way through. As you notice, you could hit that 14% ration spot and feed them kind of right along from weaning all the way through finishing at that 150, 200 pounds, whatever it might be. So on a grow-finished lamb perspective, what would that ration look like? Probably something like shelled corn, some supplement, which would primarily carry a wee bit of protein, your mineral and vitamin package, perhaps an ionophore, and then some good quality hay or pasture, and that'll get the job done. So I always like best management practices or BMPs. If you want to go ahead and pellet that ration, that'd be great. That'll get your feed intake going up at a little bit faster rate. Good time to vaccinate for enterotoxemia, which is overeating disease, and that usually requires a booster. If you're going to make ration changes, do them gradually. Stretch it out over a week. Regular feeding schedule, especially if we are utilizing some hand feeding of grain, twice a day, regular schedule. High quality forages, about 12 inches of bunk space per lamb. That's if we're feeding them inside and you have a feeding setup. They need about a foot of bunk space per animal in order to encourage maximum intakes. And then, of course, as always, free choice water, and they actually like a good free choice salt block as well. That'll really do the job. Just kind of finishing up on that, self-feeding, which here I'm talking about ad libitum. Basically throwing a grain feeder out there and letting them eat all they want. They'll eat more grain, and it certainly saves more labor. But certainly, it's not like you can throw feed out there and just walk away either. If you want to go hand feeding, where you're going to more control their intake, again, twice a day, that will improve your chance to catch problems. And especially if you're going to silage feed, you're going to need to do that anyway, every day anyway, in order to keep the silage fresh. If finishing on pasture, that gives you a lot of flexibility, because you can go a lot of pasture early and then push them right at the end with grain, or you can just let them finish on pasture. It'll be a little bit slower, average daily gain wise, but certainly cheaper. And a little bit more efficient from a labor perspective. So always make sure that you're fortifying correctly with mineral vitamins. So if you're going to pasture finish your lambs, probably need a salt block out there, perhaps a little bit of a lick tub or something like that provides your mineral and trace mineral and vitamin needs in order to make sure that these lambs stay healthy and growing efficiently. A few more things on those early versus late lambs as we're getting those lambs going. Again, dry feed consumption on early lambs should get going by about day 10. And again, highly recommend creep feeding. Kind of almost have no choice at that point in time. It makes the most sense to do. It's going to improve your average daily gain and feed efficiencies quite a bit. And because of the lack of availability of pasture, it will work fairly effectively. Late lambing, then, of course, you should rely, and you're probably planning to rely on good quality pasture. And your best quality lambs, you can market them right off of the pasture with almost no grain at all. And then those that are maybe a little bit behind or the later part of the lambing season, you can put a little grain to them and finish them to create a little bit more value. So as we identify your replacement ewes, then, those lambs that you want to keep in the breeding herd, keep them in the flock, we would like to feed them, get them to the correct body weight by about 7 to 8 months of age so that they're ready to lamb at 1 year of age. And so the keys, how do we make that happen? We want ewes to get to production efficiently, shorten that generation interval, increase lifetime production. We get more lambs from that ewe over her lifetime. And we can push those replacement ewes to replacement lambs. We can push them to identify which ones are the most genetically productive before we keep them in the breeding herd. And just make sure that we don't get them fat. Lambs and ewes don't handle overconditioning very well, especially when we deal with pregnancy. All right, a few other miscellaneous keys, and then we'll deal with some disorders here at the end. Urea is fine to use as long as you don't get carried away. About 1.5% of their diet. It's a very cheap crude protein source, as you know by now, and really only appropriate for the grow finish ration. Be cautious of utilizing it in the wrong way. Ammonium sulfate or ammonium chloride is very appropriate to get in your sheep feeding rations because sheep are susceptible to a disease called urinary calculi, basically like a stone that gets in their urinary tract and it triggers an infection. So you want to have a proper amount of that negative balanced ion in there in order to help prevent those things. Additives, some medications here, chlorotetracycline or Oxytet for nursing lambs. That'll help you with gain and feed efficiency, minimizing and dealing with those stress, work with your veterinarian on a VFD for those kind of things. Mind your feeding rates and withdrawal times as always, and then coccidiosis is always a kind of a standing risk, and so Bovatec helps you with that. I've got enterotoxemia here, but let's transition and add that in a little bit more detail here in one of the final slides as we talk about the two main metabolic issues as it relates to sheep and lambs. Enterotoxemia is overeating disease, and it's a Clostridium perfringens bacteria. And that is a naturally occurring bacteria in the gut. And just for whatever reason, there's some kind of combination of grain that will trigger that bacteria to just grow at a very high and prolific rate. And that then crosses over into the bloodstream and causes a bacterial infection. And it goes from nothing to something in the matter of 12 to 24 hours, and you'll come out and find some of your best performing lambs dead. And it's really nothing that you've done wrong. It just is what it is. So in order to prevent it, you vaccinate about 5 to 6 months. I got a little typo there, 5 to 6 months. Vaccinate those ewes before lambing, early wean lambs, older lambs, especially if you're going to transport them, to help try and treat it. And you can therapy with an antitoxin that works for about 2 to 3 weeks. But it can be very highly fatal, so you want to be ready for enterotoxemia. The other one is pregnancy disease, also known as lambing paralysis or ketosis. And this is where we run into a situation where we don't have enough usable carbohydrate in the ration. So again, that ewe is pulling weight off of her back. She's mobilizing body fat in order to feed the lambs, whether they're twins or triplets. That creates a higher risk. And you'll smell a really pungent acetone smell, a kind of sweet, pungent acetone smell on their breath. Those that are dealing with it will probably not eat as well. They'll lag behind the herd. They'll have a little bit of paralysis, which of course speaks in the name. So important that we have proper nutrition prior to lambing, focus on that body condition score maintenance, and then treatment with a number of different things, whether it's propylene glycol or dextrose. And then if you want to do a little preemptive thing prior to lambing, molasses inclusion in the ration at about 1/4 to 1/2 pound per head per day will help create some additional sugar and carbohydrate in the ration, help you fight off pregnancy disease. So your take-home messages, in order to create this beautiful rack of lamb here that you've got, keep your costs down with great quality forages. As always, big fan of those. Maintain excellent quality pasture. Supplement as needed, and then focus on body condition score. That'll help you prevent a lot of challenges. So that concludes Unit 10. I'll look forward to having a discussion with you in class.